Thank you so much to Interfaith Glasgow for such a warm welcome already that we've received. I'm so honored to be a part of this panel. Thank you for inviting us, for inviting me and my colleagues at PSI to participate. As an organization, we live in the intersection between psychotherapy and spirituality, recognizing that for most people, spirituality is really an important value for them and also a resource in times of stress and crisis. So if spirituality has to do with meaning making in one's life, then the pandemic of COVID-19 is at its very core a spiritual journey. It has to do with a profound reflection on and perhaps realignment of one's deepest values as we deal with issues of mortality, isolation, fear, and anxiety. In the time that I've been allotted today, I'd like to just briefly deal with 3 points, 3 issues that have surfaced for me in the course of the pandemic. First, mental health professionals and for their clients, telehealth is our new reality. The shift from in-person meetings to remote sessions on Zoom happened literally overnight. The strangeness of this new way of working was immediately apparent, bringing both benefits and challenges. The chief benefit was that therapy could continue uninterrupted in a seamless way. Most of my sessions are video sessions. Some of them are on the phone. Research to date shows that mental health care delivered remotely is effective. And there is now a substantial literature base demonstrating that telehealth interventions work for a wide variety of problems and populations. To give one example, the Hazelden Betty Ford Foundation in New York City, whose mothership is in Minnesota, offers outpatient alcohol and drug abuse treatment. And since the start of the pandemic, has had a full line of virtual behavioral health programs right from the start. And so this kind of remote treatment has been essential in the time of COVID-19, and maybe particularly essential since the issue of addiction is so important as people are in lockdown and in isolation. Telehealth allows people to come in from distant areas who otherwise would not have been seen. I've had a handful of clients, former clients, return to therapy with me, some of whom moved out of New York City years ago, but now, since they don't have to travel here for an appointment, are free to return. More importantly, telehealth has the potential to address the needs of people in areas of the country that have few resources for mental health. This raises the issue of a central challenge with this mode of working, which is the digital divide. Those who have access to computers, broadband, wireless connections, and those who don't. This is not only an economic divide, it's a racial divide, it's a generational divide. One of the churches in New York City that PSI partners with on occasion, the Church of the Heavenly Rest on the Upper East Side, is really doing wonderful work in addressing this issue of the digital divide. They are reaching out to create communities of care. Using funds that they have raised, they were able to get broadband to about 12 churches in Harlem and the Bronx, so that those churches could live stream their services and meet the pastoral needs of the congregations. I would suggest that it also meets the mental health needs of those congregations, since body, mind, soul, and spirit are one. As a church, they've also crafted a statement of intent in which they commit themselves to seek out Black and minority-owned businesses as their vendors of choice and are reviewing their hiring practices as well, with an eye to making a difference where they can. So these are just some ways that some members of the faith community have been reaching out. A second issue that has become very clear and which I expect will persist for a long time is that of separation and sometimes estrangement between families and friends, neighbors and coworkers as a result of political polarization. We are in what some would call a post-truth era, an era of alternative facts. As Alice in Wonderland would say, words mean what I want them to mean. This polarization is not relegated just to the United States. There is, after all, Brexit. So we as mental health professionals and faith leaders need ways to keep the conversation going. We need to find ways to create communities of care within and across diverse populations. When you consider what happened in the Capitol in Washington, D.C. 2 weeks ago with a violent assault on our Capitol from domestic terrorism, we understand that this issue of polarization is wide and deep and is not going away. And the faith communities and mental health professionals need to be in the forefront of addressing these issues as well. Finally, I want to speak to the issue of grief. Not as a mental health challenge, though it may be that, but as a human issue. The death toll in the United States as of January 2021 is over 400,000 lives lost. That's 400,000 grieving families, husbands, wives, children, colleagues, friends, neighbors, coworkers. COVID-19 has meant that families were unable to be with their loved ones. FaceTime has replaced holding the hands of those we love as they died. This inability to say goodbye, this inability to bring resolution and an ending to the ending, the inability to hold and to comfort creates complicated grief compounded by shock and trauma. It leaves people potentially vulnerable to what the poet May Sarton has called mourning without end. Our country is awash in grief. Faith leaders could provide only a pale reflection of the rich liturgies and rituals that people lean on when grieving. For those of you who saw the memorial service in DC the evening before the inauguration, you saw an exceptionally beautiful ritual. It consisted of poetry, prayer, silence, and song. The visuals were stunning, with 400 light boxes shining in the reflecting pool. It was the first time that we as a country stopped to remember and mourn the victims of COVID-19. Faith leaders are on the front line of creating and holding the space for this kind of remembering, as are mental health professionals. I would like to close with a poem by a woman named Lynn Ungar. Lynn Ungar is a Unitarian Universalist minister, and her poem is entitled Pandemic. What if you thought of it as the Jews consider the Sabbath, the most sacred of times? Cease from travel, cease from buying and selling. Give up, just for now, on trying to make the world different than it is. Sing, pray, touch only those to whom you commit your life. Center down. And when your body has become still, reach out with your heart. Know that we are connected in ways that are terrifying and beautiful. You could hardly deny it now. Know that our lives are in one another's hands. Surely that has become clear. Do not reach out with your hands. Reach out with your heart. Reach out with your words. Reach out all the tendrils of compassion that move invisibly where we cannot touch. Promise this world your love, for better or for worse, in sickness and in health, so long as we all shall live.